Hey everyone, my name's Sarah, and my current placement is at Henry Ford Hospital in Macomb. And I'm working with several different professionals. I work with Kristen and Deanna, who are the acute care SLPs, as well as Carrie, who works with patients who are in our inpatient rehab unit, and Nikki, who's a recent graduate of MSU, and she splits her time between working with patients down in acute care as well as inpatient rehab and two different facilities through Henry Ford with outpatient rehab. I do a lot of bedside swallow evals with the patients in acute care, as well as treatment for swallow and some treatment for speech and language and cognitive functioning. We also do modified barium swallows, and I have been able to see a couple different patients who are in our inpatient rehab unit. I work with one patient in particular who has severe expressive aphasia and apraxia. I've been working with him pretty consistently since he's been here. And then I also have been able to eval a couple different patients who have come to our inpatient rehab unit. So I'm going to talk a little bit about the evaluation process and the assessments that we use. We have an in-house form that we use for assessing patients down in acute care as well as in the inpatient rehab unit. It's a collaboration of several different assessments like the Boston, the Minnesota, and the Arizona. And it looks at speech, language, cognitive functioning, and higher level language skills. So this is a form that we would use with patients down in the acute care as well as in the inpatient rehab. Down in acute care, it's going to be a little bit more efficient, but it's still thorough and comprehensive and gives us a good understanding of their skills and areas that we could be working on with them. Along with using that form, we also like to assess their reading comprehension using the RCBA-2. So the RCBA-2, some of you may be familiar with, but it has several different subtests, and it looks at single word comprehension, where they're going to see a picture and then have to match the written word down below with the image. And then it also does things, or assesses different areas like paragraph comprehension, where they're going to read a short paragraph and pick the picture that goes best with that paragraph. So that gives us a little bit of a better understanding of where they're at with their reading comprehension. Then we like to use these photographics to look at their safety awareness. So we'll show them two different pictures. Here's one, and then here's another. And we're going to have them point out which picture is unsafe, and then either identify if you're pointing or verbalizing why it's unsafe. And then we also like to look at their sequencing abilities using the everyday activities to sequence. There's 3-step, 4-step, and 5-step activities that they're going to put in order, and we like to usually have them do a couple of each to see where they're at with that skill. That's pretty much the assessment process that we go through with the patients here. I would love to be able to give you a little bit of a tour of the facility and show you the gym that we have here on the rehab unit, but unfortunately there are patients being treated right now, so due to confidentiality reasons, I'm just going to have to stick with this office. I'm currently in one of the speech paths offices right now. I'm using Kristen's office, and for charting here, we use PowerChart, so everything is done electronically, which is really nice. And this is my second time being at Henry Ford. I was able to do my summer internship here, which was just the 6 weeks or 7 weeks, and then I was able to come back for my spring placement, which was really great. So I get a little bit of an extended stay. And during the summer, I split my time between inpatient and outpatient, so I got to have a little bit of an idea of how things go in both of those settings. But this time I'm going to be spending my entire time here in inpatient, so it's been a really great experience. I'm enjoying it a ton. I'm learning a lot, and I hope that gives you a little bit better of an understanding of what it's like being an intern here at Henry Ford. And thanks for watching.